They told us routine checkups were the gold standard of prevention. But what if I told you that after age 70, some of the most common medical tests might actually do more harm than good? Behind closed doors, buried in the footnotes of medical journals, studies have quietly revealed that some health screenings, often done out of habit, can trigger a chain of unnecessary anxiety, invasive follow-ups, and even irreversible damage in seniors. Most people don't know this. In fact, 99% of seniors over 70 are still undergoing tests that have been scientifically shown to offer no added benefit and, in some cases, increase mortality by as much as 20%. One of them increases your chance of complications by up to 35%, even when you're perfectly healthy. And the number one test on this list could land you in the ER by increasing your risk of lung collapse by over 25%, even if nothing is wrong with you. Now, to be clear, this video is not personal medical advice. These insights are for education only. Always talk with your doctor before making any screening decisions. But everything we'll share here is based on real studies, real patient stories, and real risks you deserve to know. Before we dive in, let us know in the comments below. Have you or someone you love ever had a test that led to more stress than solutions? And what's the one test you feel really unsure about? We're reading and replying to every single comment, so don't hold back. Now let's start with number 5. Number 5, carotid artery ultrasound. This test is often offered to seniors as part of a stroke prevention package. It uses ultrasound waves to look for narrowing or blockages in the carotid arteries, which are the blood vessels that carry blood from your heart to your brain. On paper, it sounds incredibly smart. After all, strokes are devastating, and early detection seems like the obvious path to prevention. But here's where it gets tricky. When this test is used routinely in people without symptoms, especially those over 70, it can become a problem. That's because the test often finds minor plaque buildup that isn't causing any symptoms and isn't dangerous. However, once something is found, the next step is usually aggressive intervention. This can include risky procedures like carotid artery surgery or stenting, which come with a high chance of complications. According to a large-scale study published in JAMA Internal Medicine, out of every 1,000 seniors who received a carotid ultrasound without symptoms, only 3 had a blockage severe enough to warrant surgery. But nearly 60 were referred for further testing or procedures that caused unnecessary stress, financial costs, and in several cases, a stroke as a complication of the intervention itself. The U.S. Preventive Services Task Force, a leading group that evaluates screening tests, explicitly recommends against routine carotid ultrasound in asymptomatic people. The reason is simple. The risks of false positives and unnecessary follow-up far outweigh the chance of catching something serious in time. That said, there are specific situations where this test is very helpful. If someone has experienced symptoms like sudden weakness on one side, difficulty speaking, or vision changes, signs of a mini-stroke, then a carotid ultrasound can be life-saving. But for a 75-year-old who simply wants a routine check, the test could open the door to more harm than good. I remember one patient, Elias, who was 76. He was feeling great, but got the test during a health fair. The scan showed moderate plaque, and he was rushed into a stenting procedure. During recovery, Elias suffered a small stroke, which left him with speech slurring and weakness in his right arms, something that never would have happened if the test was avoided. Instead of routine ultrasound, the better path is lifestyle modification and blood pressure monitoring. Those reduce stroke risk more effectively than any scan. Let's now move on to the next one. It may surprise many of you. Number 4. Routine vitamin D testing. It sounds harmless, doesn't it? Just a simple blood test. In recent years, vitamin D has been marketed as a miracle nutrient, so testing for it seems like a no-brainer, especially in older adults. But here's the catch. For people over 70 who aren't showing symptoms of deficiency, routine testing rarely changes anything. Worse, it often leads to oversupplementation, which brings its own serious health risks. According to a study in the New England Journal of Medicine, more than 40% of seniors who tested low on vitamin D had no clinical signs of deficiency at all. And yet most of them were placed on high-dose supplements. What happened next was alarming. Among seniors taking over 4,000 international units daily, the risk of kidney stones increased by 23%, and rates of hypercalcemia, Overload of calcium in the blood that causes nausea and confusion jumped by 18%. The problem is that vitamin D levels vary depending on the season, the lab, and even your hydration. These fluctuations are often misinterpreted, leading to a cascade of interventions that aren't necessary. Routine testing also doesn't predict fractures as clearly as once thought. A large meta-analysis in The Lancet found that in seniors without symptoms, vitamin D supplementation did not significantly reduce the risk of fractures or falls. But there are cases when testing is warranted. If someone has osteoporosis, a history of frequent falls, or specific signs like chronic muscle weakness, then checking vitamin D makes sense. I'll never forget a woman named Samira, age 81, who came in feeling dizzy and tired. Her doctor ordered a vitamin D test, which showed a slight deficiency, and prescribed megadoses. A week later, she was hospitalized with nausea and confusion. It turned out her dizziness had nothing to do with vitamin D. It was a blood pressure medication side effect. The test created a distraction, not a solution. The better approach is to assume that seniors may benefit from a modest daily dose, around 800 to 1,000 international units, without needing blood tests unless symptoms arise. Now get ready, because number 3 is one of the most debated tests for older men. Number 3, the PSA test for men over 70. The PSA test is one of the most controversial screenings in modern medicine. It measures the level of a protein produced by the prostate gland. Elevated PSA levels can sometimes indicate prostate cancer. But what most people don't realize is that high PSA can also result from benign conditions like inflammation or age-related enlargement of the gland. For men over 70, the test requires even more consideration. That's because prostate cancer in older men often grows so slowly that it probably won't cause symptoms or shorten life. But once the PSA test number is high, biopsies usually follow, which are painful and carry risks like infection and bleeding. Even worse, when a slow-growing cancer is found, some patients are directed to aggressive treatments, like surgery or radiation. These treatments can cause long-term side effects like incontinence and erectile dysfunction. A landmark study in the New England Journal of Medicine followed over 180,000 men and found that routine PSA screening did not significantly reduce prostate cancer deaths in men over 70. In fact, it led to a 50% higher chance of being diagnosed with a cancer that never needed to be found. The U.S. Preventive Services Task Force currently recommends against PSA screening in men over 70 because the harms of unnecessary diagnosis outweigh the benefits. If an older man develops symptoms like difficulty urinating or blood in the urine, then testing makes sense. One case I saw was Ibrahim. He was 74 and felt completely fine, but got his PSA tested after a friend's diagnosis. His result came back slightly elevated and he was sent for a biopsy. The biopsy led to a diagnosis of low-risk cancer and he was rushed into surgery. After the operation, he lost bladder control and struggled with depression. 5 years later, his cancer still hadn't progressed and probably never would have. Instead of routine testing, older men can be guided by symptoms and risk factors. Pay close attention now, because number 2 is a test that seems completely harmless, but may cause the most silent damage of all. Number 2, routine electrocardiograms. The EKG is one of the most common heart tests in the world. It uses small electrodes to measure the electrical signals of the heart. The entire procedure is quick and painless. Because it's so easy, many doctors include it in a standard checkup, especially for seniors. But here's the truth most people never hear. When used as a routine test in someone without symptoms, especially over age 70, an EKG can become the start of a very dangerous path. That's because even tiny, harmless changes in heart rhythm can appear on the results, especially in older hearts that have naturally aged. These minor blips are often labeled as abnormal, which triggers a snowball effect. Suddenly, you're sent for stress tests, echocardiograms, or even more invasive procedures.